everyone. I am very happy and excited to be back with all of you. And I hope you had a wonderful day, or you are possibly in the US like Amy is, and you are just kind of starting your day, right? Thank you so much for joining us tonight. And as you can see, we have a very special guest with us tonight. And I'm very happy that we do have another interesting and also new topic for us. Thank you so much, Amy, for joining us tonight. As you can see, this is Dr. Amy Divaraniya. I hope I said it correctly, sorry. But I am very happy to have you here. And you have brought to us a very interesting presentation and a very interesting product. But of course, I will leave it to you. You will be able to explain everything on that. And how are you feeling, Amy, tonight?
I'm good. Honestly, I'm getting over a cold, but I'm well prepared. I have my tea, I have water. We're good.
Yes, exactly. Thank you so much. Of course, so happy that you are able to be here with us. And as I mentioned, our topic, as you can see, early pregnancy symptoms. And this is something new also for us. And I think it's very, very interesting to see what it's all about, actually, because, of course, as I mentioned, Dr. Amy, she is the CEO and co-founder of Oova. And as I mentioned, let me leave this to Amy. She will be able to explain on how everything works, right, Amy?
Yep, sounds good.
Excellent. Thank you so much. And just let me remind everyone that, of course, we will start with the presentation, but afterwards, it will be time for your questions. And I know that you love that part. So, as always, please remember to type the questions in the chat section. You can do it during the presentation and afterwards. And Amy will answer all the questions for you one by one. So, don't miss your chance. Ask anything that you have in mind. And also, before we start, as always, I want to remind everyone that we are here every single day as we want to support you, provide you with different topics, but also answer your questions and give you the opportunity to simply get to know some of the fertility experts, but also some of coaches, psychologists. So anyone we try to bring here, anyone that will be able to simply help you, support you, and answer all of your questions. And my IVF Answers, as you know, is a part of European Fertility Society. And we are very, very proud to be here every single day with new topics, new specialists, and of course, simply help you out as much as we can. And that will be it from me right now. So let's start with the presentation, okay?
Sounds good.
Perfect. Thank you so much. Go ahead.
Hi, everyone. As Caroline said, my name is Amy Divaraniya, and I am truly honored to be invited to present at this event. Today, I'm going to be discussing common symptoms women experience early in pregnancy, even before they take an at-home pregnancy test. So aside from just those symptoms, we're also going to be covering why these symptoms occur, so you can leave with a thorough understanding of the importance of our reproductive hormones and how critical they are in the pregnancy process. So before I dive into the meat of the presentation, I'd like to tell you a little bit more about me. I have a PhD in biomedical sciences with a focus on genetics and genomics, but my background is pretty solid in biology. I've worked in industry for quite some time. I was a data scientist at Roche for about 5 years, and then a researcher at Bristol Myers Squibb prior to that. The reason that ovulation and fertility has become such an important topic for me is because I went through a difficult time trying to conceive my son. I realized that despite all of the education I'd had in biology, pre-med, bioinformatics, I hadn't really been taught the basics of my menstrual cycle, nor was I armed with the knowledge of how to get pregnant or what it meant to be pregnant, although I knew very well how to not be pregnant. I had expected my journey to pregnancy and parenthood to be difficult because I've had irregular cycles my whole life. My husband and I were both a bit older when we started trying to conceive. We were already well into our 30s. And I also have an autoimmune disease, which has been affiliated with infertility. Despite all of this, my husband and I decided we wanted to pursue parenthood naturally and not go down the invasive route. So personally, I just didn't think I could deal with the loss of a failed cycle. And while this was a super easy decision to make to pursue parenthood naturally, it was a really tough pill to swallow. I started doing everything right. I started peeing on sticks every morning. I started taking my body temperature 4:30 a.m. every day, and I used every fertility tracking app. And luckily, after 18 months, I conceived my son, but those 18 months were the most devastating of my life. The worst part was that after I'd collected all that data, I didn't really learn anything about my cycle. I also realized that all the tools I was using were basically hardwired for women who had a perfect 28 to 30 day cycle, and that just wasn't me. The piece of information that was really missing from my data set was accurate measurements of my key fertility hormones. And I realized that if I had that data, I would know exactly where I was in my cycle and I'd know what to do and when to do it. And that's really where the idea for Oova was born. I wanted to build something that was personalized, non-invasive, and could be used in the privacy of a woman's home. So my team and I have developed the first at-home test that quantitatively measures two key fertility hormones through urine and tracks that data over time. We tell a woman when her most fertile days are and confirm if she's ovulated. It's a completely personalized experience since we capture what her unique hormone baseline levels are, and then we detect fluctuations by comparing to that. The product comes with enough urine strips for a single cycle and works alongside the smartphone app. The app will indicate when a woman should use an Oova strip, so she doesn't have to guess or waste any test strips. Once she provides a urine sample, she waits 10 minutes and then scans the test strip using her phone. We interpret the results right there and provide the woman with her results within seconds. She doesn't have to mail anything to a lab or send anything to her doctor. We take care of all of that for her. The results are visible to the woman on her app if she's working with an Oova provider. They're available on her app, and if she's working with an Oova provider, they can view her hormone data and all the relevant information in their clinician dashboard. Our primary goal with Oova is to embrace every woman's unique fertility profile and empower her with information about her overall health. Now, I know we're talking about pregnancy, but there's a lot of basics that you need to be aware of so we can understand what is happening during the early phases of pregnancy. So let's go over the menstrual cycle. And I know we're all taught that the menstrual cycle is about your period and something happens with ovulation and LH, progesterone all have a role in it. But what does that actually mean? The main players that we're going to be discussing today are estrogen, luteinizing hormone, progesterone, and human chorionic gonadotropin, or HCG, as is commonly called. The menstrual cycle is broken up into two primary phases, separated by ovulation or the ovulatory phase. I'm guessing you can't see my mouse, so that's okay. But you can see in the middle, we have the ovulatory phase. The first part of the follicular phase is the woman's period. During this time, estrogen and progesterone are both low, which results in the top layers of the thickening uterine lining to break down and shed. Around this time, several follicles begin to develop in the ovaries, and each follicle contains a single egg. Soon, one follicle will continue to develop, and this follicle begins to produce estrogen, which is this rise that we begin to see further along in the cycle, right before ovulation. As the estrogen levels continue to increase, it signals to the pituitary gland in the brain to begin releasing bursts of LH. So LH doesn't come out in a single stream. It comes out in these little bursts. So basically what happens is your LH starts to pool and the levels begin to rise. And this is commonly known as the surge. When the LH levels peak, the egg is stimulated to be released from the ovary, and that's the process that is known as ovulation. During this period, the estrogen levels will decrease to allow the egg to actually be released. Once the egg has left the ovary, the luteal phase begins. LH levels will decrease, and the follicle ruptures after releasing the egg, which then begins to form a corpus luteum, which produces a progesterone. And that's what this progesterone rise starts to happen later on in your cycle. During most of this phase, the estrogen levels are also high, and progesterone and estrogen cause lining of the uterus to thicken more to prepare for possible fertilization. You have to remember that everything that your body is doing is trying to optimize your chances of conceiving. If the egg is not fertilized, the corpus luteum will break down and no longer produce progesterone. The estrogen levels will decrease and a period will occur. However, if the egg is fertilized, the corpus luteum continues to function during early pregnancy to help maintain that pregnancy. This embryo, so what happens is like your egg is actually fertilized with the sperm, it forms an embryo, and the embryo begins to move down the fallopian tube to the uterus and attaches to the wall of the uterus or implants. Once that implantation happens, the growing placenta starts to release beta HCG, or I should say HCG, into the blood. And this is the rise in the hormone you begin to see at the end of your cycle. So this means that successful conception has happened. So why do women have a period? It's the start of the menstrual cycle. It's the first day of bleeding is really the first day of her menstrual cycle. So you start timing everything from that point on. The period is actually indicating that the woman did not conceive this cycle. And we've kind of talked about this already, but what has happened is basically the egg has not been fertilized. The endometrial lining of the uterus has no need to thicken any further, so it starts to break down. And that is the discharge that you see that happens during your period. So let's go over what happens during pregnancy. Now, this is a long list of early symptoms. We're going to go over all of these, but what is really important to keep in mind is that what a woman's body is going through during pregnancy is a pretty extraordinary change, right? Like, aside from what's happening physically, where like all your organs have to kind of shift and move to make room for a growing baby, that's all being driven by hormones. So each change or each of these symptoms that I'm listing here are actually driven by a critical step in the process of preparing your body for conception, or by one of the hormones that we've just discussed. And we're going to go into each of these in a bit more detail. So the first symptom that some women experience is cramping, and about 30% of women experience this after conception. The cramping is triggered by implantation, so when the fertilized egg is actually attaching to the uterine wall. The uterus may begin to start to stretch now and to prepare for that major growth that's going to happen over the next 9 months. And this can actually be the main cause of the cramping. But as the uterine begins to grow, women likely start to feel mild to moderate cramping in their lower abdomen or lower back. The feeling could be something similar to pressure or stretching or pulling. The problem is that many women agree that this cramping can feel very similar to typical menstrual cramps. And this is why this symptom often goes unnoticed, and as it happens incredibly early in the pregnancy and can be attributed to a woman feeling like something they experience pretty regularly. The next symptom that we'll be discussing is moodiness. So during the early days, did I skip a step? I think I might have. Here we go. All right. During the early days of gestation, a woman experiences a massive flood of estrogen and progesterone. Together, the two hormones can have an impact on a woman's emotional health. Estrogen works throughout the entire body and is active in the region of the brain that regulates mood. This hormone is associated with anxiety, irritability, and depression. Progesterone, on the other hand, is a hormone that actually helps to loosen your muscles and joints and prevent early contractions. So the reason progesterone is so important is because, as I mentioned before, all of your organs are starting to push out. They're trying to make space. Progesterone actually helps loosen all the muscles that are keeping everything tight and in place so that this movement can happen. However, with the increase in progesterone, it can often cause fatigue, sluggishness, and even sadness. One of the most common symptoms that women experience is fatigue. And this is, I guess, fatigue or extreme tiredness. During the first few weeks of pregnancy, the body is working 24/7 to support this pregnancy and get everything ready for it. Fatigue is a normal response, and it's really the body's way of telling it to slow down, give it time to adjust to all the massive changes that are happening internally. But on a more physiological level, what's happening is that the blood volume that needs to actually increase to supply oxygenated blood to the developing placenta and fetus. So the heart actually has to pump faster and stronger to meet the demand that leads to women feeling more tired. Women often experience symptoms like faster pulses or breathing less, and it's really all tied to the fact that your heart is just working a lot harder than it has in the past. This is all driven really by progesterone, because as I showed you earlier, once ovulation happens and the corpus luteum actually starts to release progesterone, once the egg is released, progesterone rises really sharply once an embryo is formed. And that's really what instigates that these changes should happen. Some women can experience fatigue as early as 1 week after conception, making this one of the most noticeable signs of pregnancy. The next symptom that a lot of women experience is a sore sensation early in the pregnancy because in their breast area. This is mostly because the body is just being flooded with hormones. And specifically, I'm referring to elevated levels of estrogen and progesterone. These hormones are working really quickly to prepare the breast for breastfeeding. The blood flow actually increases to the area and the breasts grow larger, but the feelings can be diverse. So a lot of women can feel sensitivity to one breast or both. They could feel it all over in a specific spot. It could be radiating outward. And what's also interesting is that aside from pain, many women also experience skin irritation and itching, and it's because the skin is being forced to expand at a pretty rapid rate. And this is a symptom that many women experience as early as 1 or 2 weeks after conception. So it's a pretty quick thing to take over. The next symptom is nausea, and I think this is probably one of the most well-known symptoms of pregnancy. This is really driven, again, by progesterone. Progesterone is one of the key drivers of a lot of the changes that you're seeing during early pregnancy. One of the roles, another role of progesterone is to slow a lot of the processes down, including a woman's digestion. So basically what's happening is that because her stomach just isn't emptying as quickly as it was happening before she was pregnant, the body thinks that there's too much going on in there and there's still food left over and it wants to purge it in some way, either through the gut or through the mouth. So that's really why a lot of women face this constant need of nausea. So a solution for this, and a lot of women do this, is actually start nibbling or snacking throughout the day. So they're getting that sensation of putting new food into their stomach, and that alleviates a lot of that nausea that women are constantly having to deal with. But another culprit of this symptom is related to beta or to HCG. The higher the HCG levels, the sicker a woman may feel, and the levels of HCG increase pretty rapidly in the pregnancy, and they can trigger the part of the brain that controls nausea and vomiting to actually incentivize that feeling. So what's really difficult is that for women who have multiples, meaning twins or triplets, they're actually going to have even higher levels of HCG than a woman who is only conceiving with one child, and they tend to feel even more nauseous throughout the pregnancy. Unfortunately, for some women, this continues for all 9 months. For others, it actually just lasts during the first trimester, and then it alleviates itself after the second or after the first is over. It really varies woman to woman. The next telltale sign is a missed period. So when a woman is pregnant, she does not continue to ovulate and will not have a period. And this shouldn't be a surprise, as menstruation is a process that occurs because an egg was not fertilized. However, women can experience some bleeding during the pregnancy, especially early on, but this is not due to the menstrual cycle or to a period happening. In order for a period to happen, the corpus luteum, which surrounds that egg, has to start to break down, and this results in a drop in estrogen and progesterone, and that's what causes the menstruation. In the event that an egg has been fertilized, the progesterone and estrogen remain elevated, and menstruation is not triggered, and the uterine lining continues to thicken to support the implantation of that embryo. However, as I mentioned, you might see some light spotting. So light bleeding is not uncommon during the early phase of pregnancy. It's often referred to as implantation bleeding. And this can occur when the fertilized egg implants into the uterus, usually around the time that a period would be expected. Sometimes this can be mistaken for a period, but the bleeding is usually just really light or spotting. There should be no passage of tissue or any heavy flow. So if you're having to change your pad or tampon or something frequently throughout the day, something is you need to go get that checked out, because that's not supposed to happen if you have successfully conceived. Another common symptom is increased urination. So many women experience an increase in having to urinate early in the pregnancy, and this continues and often substantially increases throughout the pregnancy. And this is mostly due to elevated levels of HCG. The increased levels of HCG cause increased blood flow to your kidneys, and your kidneys actually become a lot more efficient during pregnancy. So what the kidneys want to do is they slightly expand its size, they start to produce more urine, and they actually enable the body to get rid of extra waste much more quickly. In addition, the swelling uterus can put more pressure on the bladder, and this can lead to an increase in the need to urinate. But it makes sense that your kidneys are kind of being overworked right now because at some point you are going to be having to dispel waste from both yourself and from the growing fetus. So the kidneys really need to be working at their top level and be as efficient as possible. Now, for many, I think the best way to confirm that pregnancy has occurred is by seeing HCG in your blood or your urine. So the way that this actually happens is an egg is typically fertilized by a sperm in the fallopian tube. So I'll just kind of air draw what I mean. There's two ovaries. There's a tube that flows out of the ovary into the uterus, which is like, I guess I can make it like this. And typically the egg is actually fertilized in the fallopian tube. So the sperm makes its way up that tube, fertilizes the egg, and then it makes its way down to the uterus and will implant into the wall. After the fertilized egg implants, the growing placenta starts to release HCG into the blood. Some HCG also gets passed to the urine, but HCG can be found in the blood as early as 6 days after the egg implants. So that's 10 days post-conception. Detectable levels of HCG is typically found in the urine as early as 5 days before a missed period. So that can be anywhere from 18 to 20 days after your the egg has implanted. And HCG is actually a really critical hormone during pregnancy as it affects the development of the baby. And you have to also keep in mind that the levels of HCG go up really fast in the first 14 to 16 weeks after a woman's last menstrual period, because that's what's actually helping the baby grow and hit the milestones that they need for a successful pregnancy. The next symptom is bloating. I think this is a pretty common one. It does appear slightly later in the pregnancy, but still is considered an early symptom. This, again, is really driven by the progesterone. Because the progesterone is causing the digestive system to slow down, it makes the tummy or the stomach feel a little bit more puffier than usual. And that slower digestion can actually cause a bloating sensation. So progesterone is really essential for maintaining that healthy pregnancy, but it can also trigger an influx of gas exhibiting as bloating, burping, or passing gas. And one of the effects of progesterone is it causes the smooth muscle tissue in your body to relax, which I mentioned earlier, so that all of your organs can kind of shift to the side and your body can kind of adapt to the new changes that are coming. However, what it does is it can also result in reduced muscle control, so a woman will actually pass gas a little bit more easily. It's an embarrassing feature, but I mean, our body is going through a pretty extensive change right now, so I think it's a small price to pay for what it's going through. And this symptom usually first appears around week 11 of the pregnancy. The next, or I guess like the last symptom I'll be talking about is constipation. Again, progesterone is the main cause here, and it's because of the slower digestive process, and food just isn't able to pass through our digestive system as quickly as it was previously able to, and this can lead to constipation. In a way, it's good because it allows for added time for nutrients to be absorbed into your bloodstream, and that's really what your body is craving. It's looking for energy to be able to keep on doing and fuel all the changes that are coming. In addition, your expanding uterus can also take up valuable space that is normally occupied by the bowel, and it can cramp that. Like, you have limited real estate inside. No matter how much you grow, there's still limited real estate. So it can cause some cramping to occur, which will affect the usual activity of the bowel. So what I've done here, we've covered a lot of different symptoms, but luckily they do not happen all at once. I've placed these symptoms that we've discussed on a timeline from the earliest women typically begin to experience them. But keep in mind that this is just meant to be a guide and that every woman is different. Some women don't feel any nausea, super lucky women. Others don't feel any bloating. You just need to understand what is normal for you and try to really understand what your body's telling you. But because a lot of these symptoms that I've listed here can be for causes other than pregnancy, a lot of women typically don't realize that they're pregnant until 4 to 7 weeks after conception. So really, the best and surefire way to confirm a pregnancy is by monitoring your hormones. And really quickly, I'm going to share a quick case study of a woman that was using Oova and successfully conceived using our test and how we were able to help her. This is a patient who was 29 years old. She had no known reproductive disorders. She had a history of hypothyroidism and Hashimoto's. Prior to trying to conceive, she was on low estrogen birth control pills for about 8 years. When she came off the pill, she was ready to get pregnant, but did not try to conceive until 4 months after. So she kind of let her body do a detox of the birth control prior to trying to conceive. During her second month of actively trying to conceive, she did get pregnant, but experienced an early miscarriage. So after that, she did start using Oova about 3 months after the miscarriage happened. We monitored her for 2 cycles, and what we learned in her first cycle was that her LH surge and peak were on the lower end of the spectrum. So that's totally fine, but what it highlights is that every woman is different. So a lot of these ovulation tests have thresholds for women to have their LH levels surpass a certain amount, and that's what tells you whether you're ovulating or not. And what we're seeing with Oova is that that threshold is actually not representative of the vast majority of the female population. So what we did in the first cycle is really learn what her peak and surge levels were. And then in her second cycle, we were able to tell her when to try to have intercourse to time out the optimal time for conception. And we know that we see that her LH surged on cycle day 14, and she experienced her peak on cycle day 15. And we also know that she ovulated because we see her progesterone begin to rise right after that. The progesterone remained elevated for the remainder of her cycle, but the really interesting point here is that the LH actually began to rise. The LH is this top chart up here, began to rise about 10 days after her LH peak. And typically, LH does not have much activity after the surge and peak happen in the first half of the cycle. So what was happening here is that Oova was actually detecting beta HCG in her urine and binding to our LH antibody on our test, because the 2 hormones, so LH and beta HCG, are actually very similar in shape. So we were having non-specific binding to beta HCG. The patient took a pregnancy test, but did not get a positive result until she missed her period, which was 15 days after peak. And we were actually able to detect that at less than 10 days prior to her getting a positive on any pregnancy test. And so by really accurately monitoring your hormones, we were able to confirm pregnancy much sooner than any of the other options that she had available. So the bottom line is that the hormones are really the telltale sign of what is happening in your body, especially when it comes to reproduction. So if you think you're pregnant, in summary, the best thing to do is listen to your body. Your body is giving you ample information about the changes it's undergoing, and you just need to be able to interpret it accordingly. If you miss your period, an at-home pregnancy test can be informative, but it should be used around the time you believe you are missing your period. Otherwise, the HCG levels in your urine may not be high enough to be detected by the test, and you will get false negatives. And that this is not accounting for Oova, since we're obviously not measuring beta HCG. We're looking at other hormones and getting the quantitative hormone levels. So it's a slightly different modality there. But really, the most effective way to confirm pregnancy is to get a quantitative HCG test by your clinician. The levels of HCG in your blood are always going to be higher than what you see in the urine, and this can be the quickest way to relieve any anxiousness you may be experiencing. And with that, I'm more than happy to answer any questions you may have.
Thank you so much indeed for this lovely presentation, and of course for providing also the clinical studies that you have there. Definitely interesting for sure. Thank you so much. And yes, now will be time for your questions. Oh, okay. You can of course go ahead and type those in. If you have anything, just go ahead and do it. There are like 2 questions right now, so let's have a look. Anna has asked the first one. Let me just simply show you this, Amy. Sorry, it's right here. So, why constipation, sorry, may occur as an early sign of pregnancy?
Yes, this is again really due to the progesterone and it causing the digestive system to slow down. Basically, the food is just not passing through your system as quickly as it was previously, so pre-pregnancy. and it can lead to constipation. But it's really a way for the body to capture more of the nutrients and absorb more of the value of the food that you just ate, so you can really fuel all the changes that are happening.
Thank you so much, Anna, for that very first question and, of course, for your answer. Okay, this is actually something I also wanted to ask. And actually, I asked you right before our webinar started. So where could we get Oova in Europe? Is it possible to get it in Europe?
We are working on it. We're only available in the US at the moment, but we will be available in Europe and in other areas of the world later this year.
That's good to hear, of course. Thank you so much. This is definitely interesting for our audience. And do you know already when, or it's hard to say at this point when exactly?
It's hard to say. We're just trying to get all of the regulatory pieces in place because we don't want to bypass that in any way. So the great thing about Oova is that we are getting adoption from clinicians, and that's the way that we want to roll this out. So in order to do that, we have to make sure that all the regulatory pieces are properly taken care of. We're not trying to bypass that.
Excellent. That's definitely reassuring. Good to know, of course, for sure. And just to make sure, you are sending those kits to in US, so anyone just can simply go to your website and simply order it, right? And you send it.
Yep.
Okay.
Yeah,
easy.
absolutely. You can order it directly from our website. We'll ship it directly to you. We have instructions on how to download the app, and then the app kind of walks you through how to set up your kit.
Sounds pretty easy. So thank you so much again for that. Okay, next question we have from Nat. So is Oova different from any other period tracking apps?
Yeah, there's a lot of differences here. Well, one big thing is that we are objectively measuring your hormone levels. So we actually give you what your values are for your luteinizing hormone and progesterone every day that you use an Oova test. Along with that, so none of the other period tracking apps are really accounting for that. But what you also can do in our app is log and track as many things as you'd like. I think we have about 24 or 25 different factors that you can track. All of that data actually gets fed into our machine learning algorithm, and we provide every woman with daily action plans that are custom for her. So our algorithm takes all the information that you're providing, and we try to tell you things, give you like little minor steps to adopt, to optimize your hormone levels, alleviate any symptoms that you're reporting, and really guide you through your entire fertility journey, whether it's trying to get pregnant or just understanding your cycle. That's really the key component that is missing from all the other period tracking apps, that there's no objective measurement. It's all subjective by you telling it what your moods are, what your period flow was, things like that. We merge all of that with our objective hormone measurements, and then everything is completely personalized for you. So we're not comparing you to some standard threshold or that perfect woman who I will proudly say doesn't exist. I believe that every woman is perfect in her own way, and we really try to own that.
All right, exactly. Thank you so much again for answering yet another question. Okay, Anna has one more for you. So what if I have irregular cycles? Is this app also for me?
100%. So we have designed Oova for the irregular woman because in my eyes, the irregular woman is the normal woman. Very few women actually have that perfect cycle. So I will be honest, and it might take us a cycle to understand exactly what's going on, but we do learn with every piece of information that you put into the algorithm, so we can really optimize it cycle to cycle.
All right. Again, thank you so much. That sounds great. And thank you so much for mentioning that, because we've done some webinars and I think that it's out there and it's more, this is a common knowledge nowadays that women need to realize that this is kind of still irregular cycles. It's kind of normal thing. We've done some webinars on that, and everyone, doctors, anyone was actually confirming that. So thank you for once again for that reassurance. And of course, let's have a look. Okay, one more question we have. So can I use Oova after IVF, after I've been taking hormonal medication?
100%. So as I kind of teased earlier, we are being utilized by about 70 clinics across the country that have actually adopted Oova's technology, and they have their patients using Oova alongside treatment or to supplement any treatment that they're going through. So the great thing about Oova is that we're getting your actual hormone measurements. And so if you're on hormonal medication, it is going to influence the results that we're seeing. But that's what the doctor cares about anyway. We don't care about what your baseline levels are without the hormone medication. They're trying to treat you with that medication in your system. So what we do have in the app is you can log what medication you're on, if you've taken it that day or not, and then we get your hormone measurements, and the doctor is able to see all of that. So quick answer, Anna, yes, you absolutely can. How the doctor chooses to use it is really up to them.
Excellent. Thank you so much for once more for that. And let's have a look. Another question is right here. Also interesting. Thanks for the info. I found all the symptoms. Early pregnancy and late period is very similar. How do you know if you are pregnant without the test?
I think really understanding your body. I'll be honest, when I found out I was pregnant, I took that pregnancy test and I thought it was broken because the chances of me being pregnant were so slim. Just because it hadn't happened for me for 18 months. And the test I took was a dud. I thought there was a higher chance of me actually having stomach cancer than being pregnant because I felt so horrible the last week before I got a positive pregnancy test. But when I did get that positive, that was the way that I saw really faint lines. Like it wasn't, I thought it was broken, whatever. I went into the doctor's office and they did an ultrasound. That's really how I confirmed that I was pregnant because I didn't believe the test. One was blank, one had a really faint line, the other one didn't work at all. So really for me, it was getting the ultrasound. So if you don't have a test, if you are trying to, your body's not, you're not able to read what your body's saying, I would go to your doctor, get that ultrasound. It's most likely going to be a transvaginal ultrasound, but you'll see a little heartbeat as early as, I think it's 5 weeks, you can start seeing that little heartbeat going through.
All right, that sounds about right. Thank you so much once more. Definitely. Actually, also one of the patients also thinks that was a great question. So thank you so much. Of course, there's a thank you from Anna, from a previous patient, for your help. And let's have a look. Another question from Margie is here. How many urine strips are available in Oova? When is the best time to start testing if one would like to know more about the cycle?
Sure. So how many strips are available in Oova? There's 15 in every kit. The reason that there's 15 is because we tell you exactly when to start testing. So what happens is when you download the app, you're taken through a pretty extensive onboarding process. So we can get a lot of information about your reproductive history, your menstrual cycle, general wellness. We feed that into our algorithm, and then we determine which 15 days of your cycle you should use the Oova strip. And the goal here is to capture your baseline levels, the LH surge, and then post-surge so we can confirm whether you ovulated or not. So really the algorithm will tell you when to start scanning. So the goal is so you don't waste any of those test strips and you don't really waste any time trying to figure it out on your own.
All right, again, thank you so much indeed for yet another interesting question. Right now, I do not see any more questions, so it's possible that we are going to finish. But of course, I don't want to leave yet. I just want to make sure that you have asked all the questions. And of course, if you don't have any more questions, we will be finishing. However, I also want to encourage anyone, if you would like to, if you will have more questions later on, remember that you will be able to simply get in touch with Dr. Amy, and I'm sure she'll be happy to help you out with her team. They are working and they are pretty busy to simply provide you with some more things as well. And I'm definitely waiting to hear that Oova is available also in Europe. That's the truth. But of course, it already sounds amazing. So thank you so much for joining. And in a minute, I will also send you, if you wish to simply ask anything, you can use the link. I will send it in a second. And there is an option to get in touch with Dr. Amy. And I'm sure, as I mentioned, she'll be happy to help. Yes, it looks like that will be our final question. But before we finish, Amy, is there anything else you would like to add?
No, I guess the main thing is that I'm always available while our first product is infertility and ovulation. Really, my goal is to help empower women with information about their health. I think it's a really big disservice that we're not taught this information early on, and I want to try to rectify that. We should be able to take control of our health and not be at the mercy of a doctor telling us what is going on and what we have to do. We should be able to go to the doctor saying, like, this is what's happening with me. how do we handle this, and then have an educated conversation with them. So Oova is really our first step in enabling you to do that. But if you guys have any ideas, or if there's some gap that you want us to address, please send me an email. I'm more than happy to have a conversation and learn what your needs are so we can really help resolve this issue.
That sounds amazing. Thank you so much, of course. And I'm so very happy that we were able to have you here and this topic, because I love this kind of topics. That's for sure. Who wouldn't? I mean, right? Only good news. And of course, we just need to stay positive and check and check and check and just hope that it's all going to work. And you are a perfect example, Amy. Yes, you mentioned that you were struggling as well. So anyone struggling right now, there are options, there are ways, and we just always need to stay positive. I think it's probably one of the best things we can do. So thank you so much indeed. And also, as always, I want to mention that we will be back here tomorrow, as you know, at actually there are two webinars tomorrow, so I hope you will be able to join us, as we will start at 5 p.m. UK time, but we also have another webinar at 8 p.m. UK time. And also remember, it has been recorded, so if you missed any parts of this, remember, if you go to myivfanswers.com, you will be able to find this webinar there as well. It will be available tomorrow. And I can only encourage you to subscribe to our YouTube channel, and you will learn that of course there are so many of those webinars there. And once more, thank you so much everyone for your questions, for being with us, for Amy, thank you for again joining us tonight, and it's been a pleasure to have you here. Have a lovely day or evening wherever you are, of course. And thank you so much. Take care, everyone.
Thank you.
Bye.
Bye. Thank you.